Funding for New Mexico in Focus provided by the McCune Charitable Foundation. And viewers like you.
This week on New Mexico in Focus, as we head into the holidays, COVID-19 threatens to overrun New Mexico's healthcare system.
As we look at the holiday season, this is the time when people really like to enjoy their family. But unfortunately for 2020, this is not the year to do that.
Plus, lawmakers prepare for a special session and ponder how to handle the 60-day gathering in 2021. New Mexico in Focus starts now. Thanks for joining us this week. I'm your host, Gene Grant. The unfortunate records keep falling. New Mexico has topped 2,000 coronavirus cases in a single day and now threatens to hit 3,000 just days later. A week into what the governor calls a reset, we're discovering just how bad the situation has become. That's especially important given the upcoming holiday. We'll get a few words of advice on celebrating with family, though there's no safe way to do that unless you're already in the same household. We'll talk about the surprising closure of the emergency unit in a hospital that serves the Native population, the upcoming legislative session or two, and of course, COVID. That's where we'll start with The Line. This is bad. There's no need to sugarcoat any assessment of New Mexico's coronavirus situation. The question now is, by issuing a stay-at-home order, are better days ahead? That's our first question for the Line Opinion panel. Let me introduce them. We've got guest panelist Giovanna Rossi with us. She's president of Collective Action Strategies. We're also joined by former House Rep and Line regular Daniel Foley up there in Rio Rancho. Line regular and attorney Laura Sanchez is always here. And another Line regular is with me this week. That would be Tom Garrity of the Garrity Group PR. Tom, I want to point out that this isn't as strict as the March shutdown. We all know that. But as I said, the question is, will it be enough? Let's just start as a baseline question right there. What does your gut tell you?
Well, it has to be enough. I mean, it's the kind of the situation that we're in right now. You know, we've got through Thanksgiving to see just how much of an impact it will take. But, you know, the proof will be in the pudding. You know, if all of a sudden infection rates are down, then it worked. If not, then, you know, it didn't.
Mm-hmm. Dan, let me go to you. What's been the reaction from your peer group, your friends, either down in Roswell, other parts of the state, or here in Rio Rancho? What are you hearing out there?
Concerning the
lockdown, right? The reset, we should call it.
Yeah. Obviously, Gene, that's a loaded question for me. I mean, you know, the circles I roll around in are, you know, they're not supportive of this, right? I mean, they say it's been interesting. I will tell you, you know, a lot of people are not opposed to the masks and not opposed to the social distancing. They just can't get their head around. So, you know, I can't go to a friend's restaurant and eat, but I can go stand in line for 3 hours to get into Costco, or I can go stand in line to get into Safeway, or, you know, I can go to a bicycle repair shop, but I can't, you know, go, you know, do the things that I want to do. So I think that's the kind of, I think people are just, at least people that I hear from are just, and they also are saying, look, we did this once before, you know, we shut down, and then as soon as we opened back up, we had a spike again. And so, you know, I think it's clear that there's really not going to be a way to contain this until there's some sort of a vaccine or the antibodies are built up, because it seems like every time we shut down,
I want to make sure you're clear here. Are you saying there's nothing else to be done until the vaccine? Isn't this the way that we're doing it now?
I said that I don't think it seems when you look across the country with closings and openings and the expanding and contracting of the orders in other states, they seem to, you know, the numbers seem to, you know, go with them, right?
Gotcha.
As you contract everything, the numbers go down. The minute you open it back up, the numbers start to go up again. So it seems like it doesn't seem like anything has worked once you open it back up again. So I'm not sure. I think that's what people are frustrated about, right? They're like, so we're going to close for 2 weeks. The numbers are going to go down. We're going to get told we can go out again. The numbers are going to go back up. We're going to get told we have to, you know, shelter at home orders again. So I just don't know. It doesn't seem like there's much that can be done. You know, we're almost at a year into this. It doesn't seems like it's been the same yo-yo.
Hey, Giovanna, I got to ask, you know, on Thursday as we tape this, you know, the governor has her revised reset, so to speak, that went into place. But clarifying that essential retailers aren't just big box stores, and, you know, Ross and others have been kind of pointed out there. You know, there's a lot of heartburn out there from retailers, local retailers, who feel like they're being unfairly treated here. How do we balance the needs of a local business with balancing the needs to keep us all safe here? Is there a better way than what we're seeing now?
Yeah, I mean, this is such a deep and broad topic, and you know, usually when we see major major issues in the community, and we have two now. We have an economic, you know, crisis, and we have a health pandemic. So we're dealing with double, you know, problems here. And usually in this kind of situation, you have legislators and policymakers spending a lot of time looking at research, you know, developing policies, and we just haven't had the time to do that. We haven't had the resources to do that.
But
so
we've had since spring, when you think about it, you know.
Right, but the research that's coming out now, it is new, right? Like
Gotcha.
we didn't have anything to look at before, and we've seen the governor responding in the way that she has, without, you know, right or wrong, it's just the way it is, you know, without the input of a lot of other, you know, wider constituents. But the question about local business, I think the new clarification of the public health order is going to help. But you know, it's just tough. It's tough, and there's a fundamental question, I think, here that isn't being addressed in any of this. I think we're talking about, you know, do these little solutions work? Does this effort work over here? Is this 2 weeks going to make a difference? There's a much broader, more fundamental question at hand here, which is, you know, how can we as a society have a strong economy and also take care of the health of our biggest asset, which is our people? And we're not addressing the fundamentals here. And there seems to be that those two things are in conflict, actually.
Laura, you know, the revised order is a reminder to bigger retailers, not necessarily big box, but bigger retailers, that a third of your income has to come from food products, things like that. Here's a list of folks that are still open: Dillard's, Macy's, Bed Bath & Beyond, Dick's Sporting Goods, Kohl's, Tuesday Morning, Big Five, Burlington Coat Factory. It's a long list. Do you hear any food in any of those folks? Why are they open?
Well, I thought that the recent revision was supposed to address those retailers as not being eligible to be open, but I could be wrong. That's how I understood the most recent revision to be. But the bottom line is that I do think that those particular retailers shouldn't have an expectation of being open. If they weren't open in the previous the previous step that we took in the lockdown back in March and April, I don't see why they would be open this time. Nothing has really changed in the type of products that they provide. But it does sound like the one thing that's different, I think, for us here in New Mexico, that wasn't the case before. When we shut down before, everything was shut down across the country. So you couldn't even do online sales, or you couldn't purchase anything and have it delivered. Now you can. So it's a state-by-state sort of issue. And other states are still able to do some commerce. So if you have some online purchases that you need to make from some of those retailers, especially going into the holiday season, you can actually do that online and still get your products delivered.
Right.
There's also still delivery of certain, you know, DoorDash and Grubhub and all those Postmates kind of services are still delivering. So I think it's really important that we take a step back and try to support our local businesses that are struggling to stay open. There's a couple of local places that I like very much that I try to order from at least once a week just to keep them afloat. And anytime we have any, you know, need to purchase anything, I try to go with a local vendor if we can. But I think there's just so much anxiety right now. You know, the holidays in general coming up provides a level of anxiety for people, even outside of a pandemic. Now there's a pandemic going on, and there's a lot of uncertainty with that. There's a lot of tension, and then there's a lot of economic insecurity out there. So I think that all of that is creating this perfect storm for people to really have severe fatigue when it comes to staying home, and just anxieties through the roof. And so it's really a public health mental health crisis at this point.
That's a good point. Hey, Tom, let me read you something from the governor's office when the blowback started to come in about this bigger retailers staying open. In part, it says, I understand people's frustrations, but the state can't write a public health order that goes through and identifies every single store. What the state can do is identify baseline principles and convey them to the public and to different industries. Now, end quote. Let me ask you a question on that. You know, I would expect, and maybe I'm just off here, but I would expect that since spring, a county like Bernalillo County by November, late November as we sit here, very much could have gone through and identified industries, stores, whatever, that would be easily able to follow the governor's criteria, but they've been swept under the rug under this long, sweeping, everyone must close kind of a thing. Have we gone wrong here by not trying to identify industries and stores to stay open in a more nuanced way?
Yeah, you know, there are a lot of really good studies out there. You circulated one from MIT that really kind of addressed, you know, the key issues as far as criteria about what stores should open and which stores are probably riskier to have open.
Right.
Here's the thing is the big challenge for small business specifically, because big business, as we can see, as we've talked about, the big box stores are going to find a way to adapt. The smaller businesses are not. And so, you know, there was about 2 months of planning that went in to establishing the public health orders. At least that's what the governor's office had shared early on, that they had been studying, you know, how to, you know, really protect New Mexicans 2 months before the public health orders were issued back on March 11th. Mm-hmm. And since that time, the state has come out with, you know, different criteria for small businesses, for all businesses, as far as, you know, the Stay Safe program. You know, companies have registered for that. They've followed the rules. They've checked all of the boxes that the state says that they're supposed to check. Then all of a sudden it's just like, well, you know what? That doesn't count anymore,
right?
Because the rules are changed. And so in essence, you know, the rug has been pulled out from underneath a lot of small businesses, no more so than what we saw with the travel tourism industry. Granted, nobody's really going to be traveling right now. Everybody's preparing for those next steps as far as the travel environment starting up again. But when you look at what has happened with the lodgers tax, it's just that the industry has been decimated. And so, you know, you have companies that play by the rules, and then they had the rules changed, even though they're following them. And,
right.
You know, it impacts small business the most.
Hey, Giovanna, Thanksgiving's next Thursday. As we all know, huge family weekend. We talked about this a little bit last week. You know, are people canceling plans? I'm not, you know, my peer group, maybe it's the people I hang out with on Facebook and stuff, I see a lot of plans being made for Thanksgiving, almost in defiance. What are you sensing out there?
Oh my gosh. Okay. Well, first of all, I just want to pick up on what Tom was saying. And I just want to say, you know, nothing about this is fair, right? Like, let's just take the word fair out of this. It's just not fair. And the fact that we're focusing, you know, so much on business, and I get it. I'm a small business owner too. Granted, I don't have a storefront and it's totally different, but, you know, it's not fair. It's not fair. As Laura said, the mental health crisis is unreal. It's incredibly damaging to, as I said earlier, our biggest asset, which is our people, right? Our human beings. So businesses are made up of humans, and we have to take care of our humans. And this is, you know, it's just not fair on any level. But for Thanksgiving, folks in my team, we have all shared our plans. We're all staying home. We're not sharing Thanksgiving outside of the people that we live with. And I think that is the general kind of rule of thumb here, is that that is the best way to stay safe and keep others safe. You know, we all have older relatives that we want to see again next Thanksgiving. And this is really, you know, our contribution. It's not fair. I don't think that we have to cancel Thanksgiving. Like, I don't think it's canceling. I think we can still give thanks. We can be grateful. We can eat turkey. You know, we can do the things. We just need to be smart and follow the public health order.
Daniel, what are you hearing out there for Thanksgiving? Just give it up about a minute here.
Yeah, I mean, you know, it's interesting on what's been said. You know, I'm here and running the gambit. We were supposed to be going out of town. We were actually going to Texas. My wife has laid down the law, and so we're staying here with just our family. You I think the biggest hurdle to this is, and I'm not, listen, first of all, let me say, I'm not angry with the governor. She's doing the best she can. I may not agree with things she's doing, but to attack her like she's waking up every day trying to figure out how to ruin New Mexico, I think is a bad move. You can only do what you can do with the information you've got at the time. But I think the thing, to Giovanna's point and what others are saying, is there is a problem when you see, and I'm not picking on this person, I'm just using it as an example. When you see stay-at-home orders in California and then the governor's filmed at a private party, I think that's the problem, that people are like, well, wait a minute. If they can go out, why can't I go out? So I would tell you it's about 50-50 with people that I know that are staying home. Even the ones that are staying home, though, are having some extended family. I would tell you they're not opening their doors to people that they don't normally interact with. Right. But I would tell you a lot less. We normally had a party of about 50, 60 every Thanksgiving at a friend's of ours, Sally Boy's Pizza. We'd go to Sal's house. Canceled. We're not doing that. Everybody's staying at home, and we're going to try to do some of this crazy video stuff.
There you go. We're out of time on that one, but we're back in a minute with the Secretary-Designate of the State Health Department.
We do have to find ways to get past this surge. As Dr. McKee noted, we're all very tired, not just healthcare workers, but as citizens in this state, of having to go under restrictions. But it is very important.
Dr. Tracy Collins picked quite a time to answer the call to serve New Mexico. The population health expert will leave UNM Hospital and become the state's next Secretary of Health. This week, NMIF correspondent Megan Kemrick grabbed a few minutes of Dr. Collins' time to talk about the pandemic response, its impact on vulnerable communities, and how she'll approach the job she starts next month.
Thank you for joining us, Dr. Collins, on New Mexico in Focus.
Thanks for having me.
COVID-19 is at the front of almost everyone's mind right now. How have you worked on the pandemic during your time at the University of New Mexico?
So I've worked on the pandemic at University of New Mexico by helping with creating protocols for reopening safely and keeping students, faculty, and employees safe once we are reopened. So I was involved with figuring out about messaging and assisting with that. Also helping with understanding testing and how we stand up appropriate testing sites, and then also with contact tracing. So those have been my efforts to help with the pandemic, in addition to my role as Dean of a college of population health, in which the epidemiologists within the college were helping with understanding the evidence and keeping the state informed.
What aspects of the pandemic response are drawn from why you decided to create a career in population health?
I see population health definitely as the partnership between multiple disciplines, but largely public health and healthcare delivery. And so for me, this pandemic really highlights the value of public health practitioners and physicians, nurses, other healthcare professionals working together to really do a good job of containing or controlling this virus, this pandemic.
The last health secretary was very open about the magnitude of the pandemic challenge and the danger of burnout. Why take this job?
Yeah, a great question. I feel like, and I think Secretary Kunkel did an amazing job. She really stepped in and was awesome. I feel like for me, I'm coming in at a point where we have to start thinking about distributing the vaccine once we have an efficacious vaccine, and making sure that we do that well. So I see this as an opportunity to make a difference. I came to New Mexico to help grow a very new college, the second of its kind in the country of population health. And that was an opportunity. And I see stepping in during this pandemic to help with the Department of Health to lead as another opportunity to give back to this great state.
How will you guard against burnout, both for yourself and for your staff?
Yes. So my approach to avoiding burnout is really to make sure that I spend quality time each day exercising, spending time alone, reading, reflecting, and then making time for my family. I want to also ensure that there's wellness for the folks at DOH. So ensuring that we balance commitments and responsibilities with personal time. so that people don't feel like they're working 24/7, even though a lot of how we respond to this pandemic will require a lot of hours, just ensuring that we make sure people have time off.
How do you plan to bring that passion that you have for population health to your work as the DOH secretary?
I think the passion will come just from making sure that we're doing a good job. And so my passion for population health, I love research. I love taking care of patients. I love understanding the needs of diverse communities throughout the state and throughout the country. That passion will carry over into my role as the secretary for the Department of Health.
The pandemic has had, as you know, a disproportionate impact on communities of color and low-income communities. People either cannot work remotely or they lost jobs in the economic turmoil. How do you plan to guide the COVID response in the state with those realities in mind?
Yeah, I'm going to use and work with the folks who are there to understand what the needs are for the communities of color and other communities as well. We really have to make sure when we think about essential versus non-essential that we're not biased against those who are most fragile. So the frontline workers are not just the folks delivering healthcare, which are very important, and they need the N95s. We also need to think about the PPE for the grocery store workers, those who are driving public transportation. And so we need to make sure that we have adequate supplies for multiple communities so that they can keep themselves safe and still continue with their employment, as well as providing eye shields, things to cover the eyes. We know if we focus on the nose and mouth, which are key, but you can also contact this virus through your eyes. So it's important for people to cover their eyes as well, maybe with a plastic face shield or goggles to try and keep the virus out.
New Mexico was really doing well for a long time in controlling the virus, and now we're seeing record case numbers that threaten to overwhelm our healthcare system. Do you have a sense of why this is happening and how much DOH and other agencies can do to help bring it under control?
Yeah, I think what you're seeing currently with the 2-week lockdown, shelter in place, is an effort to try and contain the virus. I definitely think we need to continue with the messaging around wearing a mask, washing your hands, and distancing. And we need to encourage people to not engage in private gatherings that involve more than 5 people, that it really needs to be a small number, and you really should stick with the folks who live with you. So as we approach Thanksgiving, as we look at the holiday season, this is the time when people really like to enjoy their family. But unfortunately for 2020, this is not the year to do that. I really want to encourage the public to hang on and wait one more year, because we really need to get a solid vaccine and to get it distributed.
A friend of mine who's a doctor here wrote a letter this week to the Albuquerque Journal, and he argues that we need to change strategy on messaging and really show the brutal reality of COVID, much as we did with smoking years ago. What do you think?
Yeah, it's, if you turn on the news, you can see the case count and the deaths going up every day. We're at nearly 250,000 of reported deaths. I think the more we can get the attention of the public, the better. And sometimes things that are more graphic will get the attention a lot better. I'm not a huge fan of that, but I do see the value if we need to get the attention of the public. For those who are naysayers that this is not a real virus, it's not that bad, we do have to take additional measures. So I think it's realistic to go in that direction.
Can I ask you a follow-up? Why are you not a fan of that? Do you think that's not an effective strategy?
It's not that it's not effective. It's just that if we could get your attention without being brutal or graphic, I would prefer that. But if it's needed, we can move in that direction.
My friend also argued that we need stronger enforcement on people violating public health orders. That includes even breaking up gatherings, being more aggressive about fines. Do we need to stop hoping people will do the right thing?
Yeah, it's a great question. I think that where we can enforce is more in public settings. It is very hard to ask law enforcement to go to someone's home and break up a large gathering. Even those efforts have failed recently, with people reporting that there's activity going on that they know isn't safe with a neighbor or so. And there's not been much response from law enforcement because it's quite challenging. And so I think as much as we can enforce it with fines, that I actually am in agreement with that. I just think it's going to be challenging if we ask law enforcement to start driving around to homes to break up large gatherings. We really need to trust people to understand that this is not the time for large gatherings.
A survey that's gotten a lot of press in the last week found that about 40% of Americans plan to travel or plan to have Thanksgiving gatherings of 10 people or more. Is there anything that we can say to folks to try and curtail this?
Yes. If you don't want to experience putting your loved ones at risk and others at risk, you would not have gatherings, large gatherings of that size you just mentioned. You know, if you're thinking, oh, this is Thanksgiving, I got to see mom and or grandmother. Yeah, you might see them at Thanksgiving, then you come back home and you may not see them at Christmas or even be able to Zoom with them because they've been exposed to COVID. This is not the time to ignore what we're telling you to do, and that's to avoid the large gatherings. Please don't.
Of course, we know there are people who simply cannot work remotely if they're frontline workers or they can't socially distance, if they live with a lot of people. How can public officials offer more support for folks like those?
Yeah, so really trying to identify alternative options for keeping people safe in multi-generational homes, whether that be additional sites where you can place people if they need to quarantine or isolate. So it really is identifying alternative options for where people can safely be housed if they need to isolate.
Are there problems that you've been able to identify that you think other departments might better be able to solve, aside from DOH?
You know, I am so new with the position at this point. I'm still gathering more information. I'm sure as I transition to my start date, I will learn more and have a better understanding of where we can offload some of DOH responsibilities to other agencies. But right now, I'm not aware of anything that we really should get rid of.
How do you see the Department of Health coming alongside other departments like Human Services as you start your work on fighting the pandemic?
Yeah, I see it as a partnership that we can help each other do a good job for the state by building on our expertise and identifying where one department can focus on a particular area and the other can address another area. I think it's the partnership piece that I look forward to with working with other departments, including Human Services.
Do you have any thoughts about how to better handle the spread of COVID in prisons and jails?
Yes, that is a very good question, like many of your questions so far. I think it's understanding what space is available in the correctional facilities that might provide for spreading people out and keeping people safe. And then certainly looking at options for safely releasing persons who are nonviolent. And if they're close to being released, can we expedite that date?
What are other issues that you hope to work on as DOH secretary?
Well, looking at recreational cannabis and understanding what the needs are in the state. There are several other issues that I'll be learning about, and I'm actually going to start gathering more information over the next several weeks until my official start date, which is December 14th. So I'll know more as we move forward.
And finally, I was wondering if you'd share how you decided to go into healthcare with your upbringing.
Yeah, so it was really kind of multifactorial. In high school, I liked chemistry and talked with a chemistry teacher about how I could use that interest. And he informed me that, you could become a chemist, you might think about medical school. And so I thought, that might be an option for me. And then I had an issue with my mother even before high school where I felt like she really didn't get good care. She was accused of drug seeking when in fact she had a small bowel obstruction. And it took a lot of visits to the ED, even an attempt to fly to another state to be with her sister, who was a head nurse in Louisiana, She didn't make it because of the layover. People noticed she looked a little strange and not well. She was dusky, not breathing very effectively. So she was rushed to the hospital, had emergency surgery. And after 3 months of being in Denton, Texas, and then we were in Oklahoma, we'd travel every weekend to see her. She made her way back to Oklahoma to continue to recover. But it was that experience with my mother, my interest in chemistry, that got me into medicine. And then as a resident in internal medicine, I realized I love taking care of patients, but I wanted to have more of an impact on how we deliver care, which led me to getting some additional degrees in public health and healthcare delivery. And those additional degrees really got me engaged in understanding the social determinants of health, or those upstream factors that determine health and health outcomes. And that really led me down the path towards population health.
Well, Dr. Collins, we appreciate you talking with us as you make this next jump in your career to head the Department of Health. Thank you.
Yes, thank you. I appreciate the time.
As we just heard with Dr. Tracy Collins, Native communities have been especially hit hard by COVID-19. It was a shock then when Acoma Pueblo Governor Brian Vayo announced the Indian Health Service was closing emergency and inpatient care at the Acoma, Cañoncito, and Laguna Hospital. That's 25 beds serving 9,000 people. Governor Vayo called it, quote, reckless, immoral, and simply unacceptable, end quote. Now Laguna plans to open its own facility next year, and the Navajo Nation built its own medical facility a few years back, so there's movement to get better health care. But Laura, the governor's issue seems to be the timing. Does he have a point here?
I mean, this is such a complicated issue. I really feel like people are making decisions based on the information they have in front of them, and not necessarily taking into consideration the impact on other communities.
Right.
And this was one where probably more communication would have been better, making a decision with additional stakeholders. And I think that's just sound advice for anybody in this situation. Leadership is important. It's important to make those tough decisions. That's why people are in leadership positions. But it's also good to try to get as much feedback as you can and buy-in from other communities. Something that drastic is going to have a very, very difficult impact, disproportionate impact on communities that rely on those services. Mm-hmm. So I think that it's hard for me to sit here and criticize a person's decision based on the information they had, but it's clear that more communication and input from others would have been helpful to avoid such a difficult situation for them.
Mm-hmm. Hey, Giovanna, Governor Vayo's issue was that he said there was no consultation with the tribe prior to the suspension of those hospital units. It's hard to imagine that, they would hear nothing, but it seems like that's what happened here. And there's an issue of fairness trying to kind of scramble here, especially given how COVID has hit some of the tribal communities in our state. Could something have been handled a little bit better from the view you're seeing this from?
Yeah, I mean, as Laura said, obviously this wasn't handled well. There are difficult decisions that need to be made and long-term planning, but someone isn't looking at the big picture here. Mm-hmm. And the fact that the federal government is bound, to have these negotiations and talks with the Pueblo, and that didn't happen, that's a problem. And so I think that I don't know that we have all the information yet about this, but clearly it's gone wrong. Mm-hmm. and someone's not looking at the impact. I mean, regardless of who's doing what and making what decision, that the outcome is that 9,000 residents don't have access to this facility anymore. And the nearest ICU beds are in Grants, and there's only 3 of those. And right. So it's a really big problem that needs, more, it needs to be addressed. Mm-hmm.
Tom, those are the clinics I mentioned up top. That's, good news. They're coming online at some point. And Indian Health Services said they didn't have enough staff to keep the ER going at the Acoma Cañoncito Laguna Hospital. And that's a staffing issue. They're leaning hard on that. In my gut, it says that's something that should have been addressed a year ago, a year and a half ago, or at the beginning of the pandemic, but something just seems to have been slid here. What's your sense of that reasoning, that there's just not enough staff at this point?
I think it's a reasoning that is based in reality. There just are not enough healthcare workers, medical workers that are trained to work in ICU. Because that is a specific type of training. I think we've seen the issues that we've seen manifested in Acoma, Cañoncito, and Laguna. The same issues are impacting the old Loveless Center in Albuquerque. They have 200 beds, but not enough staff to really, bring that dream to reality as far as additional beds in the area. So right now, it's a huge issue of staffing. And then also the other issue is on trust, because right now the messengers, whether it, from the state and from the federal level, we need to have, fresh faces with, fresh credentials to really start talking about the reasons why decisions were made the way that they were made in Acoma, as well as, the type of criteria that we need to be able to see for these other hospital rooms and beds to become available.
Dan, let me read you a quote. Senator Tom Udall, who is also vice chairman on the Senate Indian Affairs Committee, I might add, quote, "Tribes across the nation have met this crisis with resilience, but their federal partners aren't rising to the challenge. It's wrong, it's dangerous, and it's a complete dereliction of duty. IHS needs to provide clear, direct answers about where the people of Acoma, Laguna, and Tehachapi are going to be able to have access to emergency and hospital care during this public health crisis." Pretty strong words there. What do you make of his reaction?
Yeah, I mean, it's, look, this is not an issue that we should be making political, any of us. I think, the sheer fact of the matter is we've touched on this, right? I mean, you're talking about, first of all, when the pandemic started, some of the biggest news nationally was how it's affecting Native Americans. I mean, some of the biggest hotspots off the charts when this first came were Native American areas. So now you're taking places that already have 2 or 3 individuals that work there, and they're saying, look, I got to get out of here. I'm not staying in, this far out. You can't leave a facility open with the idea that it's an emergency room if you don't have people trained to handle emergency cases. And so I think Senator Udall, instead of waiting until this happens, having been on the Indian Health Services Committee, I think that, we should be looking ahead of the time saying, hey, maybe we shouldn't have 3 people that can work at this facility. We should have 9, and we should have a rotation, and we should do something. Now, I think they're not thinking outside the box, the federal government, because I do think there's ways to address this, and it's utilizing our military. Now, I'm not sure how excited Native Americans would be to embrace that, but, you can't tell a civilian you're going to go work here, but you can send Army Corps doctors, you can send, naval doctors and say, listen, we're stationing you at Acoma for the next 90 days. Right. But that takes a conversation. And I think when you start seeing this kind of stuff, when you see this stuff being fought out in the media, everybody just decides to stop talking about it, which doesn't help the citizens that need the help the most. Who needs the help the most is going to someone like Senator Udall and saying, all right, let's talk about this. How do we get some funding? How do we get military folks dispatched, making sure the tribes are on board to have military folks on their sovereign tribal land and say, listen, we've got the opportunity to do this. But I think it's a legitimate concern, right? That, you're taking civilians that are living in some of the hottest spots that you see on the media every day. And I think they're saying, look, I don't want to stay here. The money's not worth it. And they leave. And when they leave, there's not a lot of folks left that can man the station, which then leaves you with no option but to.
But I think that the staffing issue is more nuanced. I don't think it's an issue of, well, there just isn't enough staffing and people don't want to be out there, although that does contribute to it. But as far as I read in the reporting, I thought it was more about the negotiations of building the new facility in Laguna and the transitioning. The staff were offered options that were not good options, and so they opted out of staying on. And so it's a much more nuanced situation that I think Senator Udall and Congresswoman Holland are right to be asking these questions right now.
Well, I would also say, it's interesting that you look at how many Native American entities we have in New Mexico, and this situation is at Acoma. It's not at Mescalero. It's not with the Jicarillas is right now. So everybody else seems to have kind of figured out how to make this work. And Acoma seems to be having some heartburn with this, which they should for their citizens. But it begs the question, where are all the other tribal entities that are being harmed by these actions? They don't seem to be there. So at some point, everybody's going to have to put the politics aside, sit down and figure out a way to solve this, because the only people that are hurting are the tribal members that live there that can't get the help they need.
Good stuff, Dan. Going to leave it there. Our panel has one last topic, the state legislature, when we return. As you've seen on the show in recent weeks, hospitals and healthcare systems have joined the call for better public health behavior by New Mexicans. We heard from doctors at Lovelace, Presbyterian, and UNM again this week and asked them what people can do if family won't stay away during the holidays. Again, while they have given their thoughts about how to cope with another stay-at-home order, there's no COVID-safe option for gathering. The official word is, don't do it.
I think our advice would be, first and foremost, not to gather with anyone who's outside your pod. And think about creative ways like a Zoom dinner or dropping off food at people's doorsteps. And that would be our first suggestion to families. If you are going to gather, and if you do have the luxury of time and are able to quarantine, if you're coming in from elsewhere, that would be helpful. There's also a few things you can do, like make sure that one pod is doing the cooking and multiple families who have not been in contact with each other are not all involved with food preparation. As you've seen, the CDC guidelines suggest that if you have not had contact with people and you're coming into contact with them over Thanksgiving, to wear a mask, even indoors, except when you're eating and drinking, to keep that mask on as much as possible. So if you have the ability to have heaters and have your meal outside, a fire pit or outdoor heaters, that would be a safer way to celebrate Thanksgiving as well. But, all said and done, I would urge our community to think about who they want at the Thanksgiving dinner table next year as they take these decisions.
We are seeing our hospitals filled well beyond what is our typical capacity. We know that these policy changes will have a positive impact on hospitalizations, will help in our ICUs, and will lead patients, people, citizens to do all the right things and not to engage in those risky behaviors that do spread COVID-19. We do have to find ways to get past this surge. As Dr. McKee noted, we're all very tired, not just healthcare workers, but as citizens in this state of having to go under restrictions. But it is very important. We can be creative, though, in finding ways to get past this. So as somebody who enjoys food and cooking, I've done quite a bit of that lately, but I would encourage people to do as I've done and figure out ways to support local businesses while still doing the things that we enjoy. So I've signed up for a couple of subscriptions at local restaurants and continue to support them as a local business, as well as do something that I enjoy.
Saying New Mexico needs to refine its pandemic relief plan and pointing a finger at the lack of federal action, Governor Michelle Lujan Grisham wants to call a special session to better craft an emergency loan plan. Potentially, she'd also like to look at repurposing CARES Act funding, too. This came as a bit of a surprise to lawmakers. And Dan, is this a think fast, react fast situation? And most of the ladies and gentlemen in the House and Senate can respond in kind without too much trouble. Or does this feel a little slapdash in your view?
Yeah, I mean, trying to call an emergency session right before the regular session, normally when that happens, it doesn't bode well for the executive when they make you come in. Mm-hmm. One of the things that everybody rallies around is, so instead of being here for 2 months, I'm not going to be here for 3 months. And the legislature normally is kind of a place that pumps the brakes. Everybody kind of gets all excited and then the bill gets introduced and you start having the hearings and all of that stuff. So, I mean, I think it's going to be hard pressed to get legislators to react to this stuff quickly, especially when, you got businesses calling them, complaining about things that are happening. You got federal monies trying to come in. You got state monies. You got the legislature trying to figure out if it's going to be able to balance the budget, what oil and gas is doing. There just seems to be a lot on their plates to try to figure this out in just a few days before they meet. I'm not sure it's going to work out.
Giovanna, beyond politics, what do you think would be the most effective form of state help at this point? More accessible severance, tax loan system, maybe unemployment benefits, a straight payment, or a tax credit? What's the best way we could go here if we're going to have a special? What should they be talking about if we're going to convene?
Well, the legislature needs to consider, how to proceed with helping some of these people that have lost income through either being laid off or just, their businesses are tanking. So there's a big budget question, and I do think that it's appropriate to call a special session to deal with this, and then of course to have the regular session. I don't know what the answers are in terms of how the funding mechanisms should work. I think that's the work of the legislature, and hopefully they have been thinking about this and making some plans. I do want to say, the governor's absolutely right. We haven't had the federal support that we've needed, and that is really, really hard. I think that there are dollars available, as was. We were discussing this before we came on live. But the thing is that for small businesses to access those dollars, it's really, really hard. And so there needs to be some structure, some system put in place to assist those small businesses to access the dollars, because right now only the big businesses are getting to do that.
Mm-hmm. Tom, the governor hasn't really put it out there saying this is what she would like to see happen. Maybe that's a good way to goose this thing along. But same question. If she is to say something, what's the best bet for New Mexicans? A straight payment, tax deferment? What's your back of the envelope gut thought on that?
Yeah, so playing off of Dan and Giovanna, what I will say is that I think the governor will be successful with whatever her plan is if she does indeed call a special session, is just to keep it simple, because anything that's complex is just dead in the water. So with the a 24-hour session, let's say it happens, and it should happen in Albuquerque, by the way, as opposed to Santa Fe. It's a whole other issue. We can tackle that.
Go ahead and pick up on that after you finish your first point. It's a legit point.
Yeah, it really should be something that's very simple, something that helps those who are unemployed, helps small business, and it shouldn't entail a whole lot of paperwork in connection with it. And as a quick follow-up, there's a lot of talk about the session being moved over into the Santa Fe Convention Center. Why not move it down to the Albuquerque Convention Center, where you have all the media have greater access, you have greater access by the public, and you have a center that can really accommodate more people than you can up in Santa Fe. And then when everything returns to normal, whatever that looks like, everything can head back to Santa Fe.
That's a point. Laura, would you agree with that? I mean, I've seen people on Facebook starting to say that too. It makes sense. It's not as much travel for the folks down south to have to go to, save an hour, but it's a big hour.
So I think that in terms of moving people, it's not that big of a deal. But when you talk about moving equipment, it's going to be a big deal.
Okay.
Moving down the street to the Santa Fe Convention Center, when it comes to all of the infrastructure, because you're still going to need to have a fair amount of equipment involved, people mic'd up, printers going, computers going, IT, ensuring security, web access, all that kind of stuff. I think it depends if they plan to sort of social distance and have, their desks or whatever. Moving things down the street is probably more efficient and less costly than it would be to move things to Albuquerque.
But Laura, do I understand it correctly? They just want to use the convention center for hearings and not necessarily for other...
But even if they did that, though, I still think that there's a fair amount of equipment that has to be moved. There's a fair amount of infrastructure that has to be set up. It's a logistical nightmare, I think, for the legislature. We're not a mobile kind of setup at this point.
And they're already set up in the Capitol building to do a lot of things online. All of the committee rooms have access. So I don't know where we are with the discussion about just doing it online, just doing it online. I know there's an
That'd
issue.
be a bad move, just to have it online. I mean, just because when you talk about open government, there's no better way to hide government than to, go into a Zoom, because you never know what other types there's just a lot less accountability.
Well, of course.
There's a lot of agencies right now that are still conducting things online. The PRC meets every week and they do it online. I mean, there's
and we're also not in a situation where we can do things in an ideal way, right? Like, we're in an emergency situation here, and we need to be, making plans that reflect that. And I think I've been involved in some of the interim committee hearings, as you all have probably, and I've been impressed with it. I mean, the legislators are getting the hang of it. The staff is really doing a good job, and the public comment section of the meetings seems to be working.
Let me pick up on that with Dan. You just mentioned public comments. Public access, Dan, is going to be an issue. Republicans made this an issue when we first started kind of going through this idea that, public access is not a good thing for our democracy, having it limited. Can we pull this off and still have the public getting the same amount of access they've always had?
I mean, I don't know how much access the public's had in the first place anyway, right? I mean, the committee rooms are small. They get, when the hot button topics come up, they limit people from coming in, and they, people get there first to take up the chairs. And, at the end of the day, I just say, there's no doubt we're in a different time right now. But every time we have issues like this, we're willing to give up freedoms and give up opportunities and give up our ability of oversight because we think it helps the situation. The reality is we give it up, and when the situation corrects itself, we never get it back. And that's a potential problem, right? If all of a sudden the best way to do this is through Zoom meetings, we had to do it through the pandemic. Oh, now we're through the pandemic, but I don't want to ride up from Roswell anymore. So I can just vote, sitting at my house in Roswell and not have to do anything. It becomes a slippery slope. And especially in a state where we have such limited access to the internet already. Right. I mean, I can tell you right now, there's a lot of folks in a lot of areas that if they don't have the opportunity to come walk the halls and, go to a committee meeting, they're not going to know what's going on or be heard.
And that goes to the point of really needing to increase broadband access statewide. So I think that should be a real priority here, because when I was in attending some of the interim committee hearings this fall, we were hearing from people from all over the state that I have never seen in the Roundhouse. And they were there giving their 2 minutes public comment. Each legislator, had to listen, look at them, and I thought that was really great. So I think there are some actual advantages to having.
I would tell you that, having just when you say that each legislator sits there, has to look at them, I can tell you what, you don't have to sit there and look at them when they're on a Zoom. But I could tell you, I watched personally and was personally involved in when people would come to testify and you wouldn't give them the 2 cents, you wouldn't give them their 2 minutes, and then you'd walk out in the hallway and they made sure they found you to let you know what they thought. I guess you try to zoom back in and tell people what you think, but that personal contact is really hard not to. There was a lot of accountability I saw. I could go on for hours about the accountability I saw in the hallways when times came when constituents would walk up and say, all right, Laura, I supported you and this is what I want, and you'd see Laura go, all right, maybe I need to rethink my position. And I just think you lose that when you go to the Zoom stuff and you lose that personal interaction, which is what our citizen legislature is based on. I mean, if we're going to go to this type of deal, then we ought to talk about not having a citizen legislature. What makes our state so unique is that the concept of you're supposed to be, as a legislator, you're supposed to be living in your district, interacting with people. People can come up, anybody can talk to the legislature. We met at certain times. The reason we meet at these times is because of the farming and ranching community. It was so heavy when we started as a state. This is when their time is dormant. They could all come up. It's just interesting. I mean, as we move technology, we're moving away from personal contact. And
let's also acknowledge that the people that really have the most access are the paid lobbyists. I mean, I get it, and I hear you about you can walk up to your legislator during the session, and that's absolutely crucial. But also, the reality of it is that 90% of the access really is the lobbyists that are paid to be there.
I'm not sure if I can necessarily agree with you. I know you're just throwing a number out there, 90%, but Dan makes a good point. That contact, that hallway stuff, That means something. It has value, for legislators as well. Let me get Tom in on this. You've spent a little bit of your time up there as well. Got about just under a minute. Tom Garrity, what do you think about the public access and the possibility of having it diminished to a critical point?
Yeah, well, to Dan's point, a lot of the, kind of legislation, for lack of a better term, takes place outside of the committee room. And it is in that face-to-face contact. And it's not that nobody's being nefarious or anything like that. It's just when you can actually grab somebody and say, hey, you know what, let's talk about this specific piece of legislation. Yep. So, I think the more we can just shed a light and, really creating more of an atmosphere where everybody can safely get in the same room together and discuss ideas and politics, I think that's a good thing.
Good stuff, guys. Thanks to you all for studying up once again this week. We really appreciate it. And please stay safe over the holiday. Over the weekend, Channel 4 caught up with a psychiatrist asking why some of us shop the way we do in uncertain times. What is this uncontrollable urge to overbuy items like TP and paper towels and everything else when the stores aren't even closing? It turns out that itch that must be scratched is a result of a millennia of human experience to not just survive, but have a sense of control in uncertain times. I can get that. Needless to say, we are complicated beings. These things beat deeply in some of us, for others a little less so. Now, next Friday is Black Friday, the now traditional opening bell for holiday shopping, mega savings. But the day after is Small Business Saturday, another and possibly more important retail tradition. Now that we have all the TP we could use, how about we give some love for our struggling retailers next week and right through the holiday season. Enjoy a safe Thanksgiving, everybody, however it may be for you this year. Thanks again for joining us, for staying informed and engaged. We'll see you again next week for the Holiday in Focus.
Funding for New Mexico in Focus provided by the McCune Charitable Foundation and viewers like you.